Clinical support staff protocols are algorithms we have for our medical technicians and nurses to take care of patients for certain types of diagnoses.
So those are different SSPs that we do as a clinic. So we allow our patients to walk in rather than make an appointment with their providers for things that we can do as technicians.
Protocols for the strep throat,
walk-in pregnancies, wart removal,
Lab results, so we'll give them normal lab results.
For patients, it opens up access to our clinics and they can get pretty much immediate care right then and there.
So time is more efficiently managed by providers, nurses, and technicians by utilizing the support staff protocols through the medical home model, and greatly benefits our patients.
The clinical support staff protocols are a win-win for everybody, from patients to techs to nurses to providers.
Clinical Support Staff Protocols, or CSSPs, are protocols designed to enable the most efficient and effective care for PCMH patients. The Air Force Medical Operations Agency, or AFMOA, continues to develop additional CSSPs. Currently, the following CSSPs are approved for clinic use: test results, sore throat, both adult and pediatric protocols, injection, wart treatment, and pregnancy test. There are 3 primary patient entry points where CSSPs can and should be incorporated into the clinic workflow. These entry points include patient walk-in, the appointment line, and established appointments. Immunization and clinical preventive service checks should also be incorporated into the clinic workflow, even for patients being seen for an acute visit. This is especially important for active duty patients, as this may be the only opportunity the clinic gets to ensure preventive screenings and immunizations are kept up to date.
How may I help you?
I was wondering, well, I took a home pregnancy test and it was positive. I want to make sure it was right.
I understand. Do you have an appointment?
No.
Okay, that is no problem at all. Please fill out this paperwork and have a seat. One of our clinic techs will be with you as soon as possible.
Thank you.
One of the entry points where clinical support staff protocols can be incorporated into the clinic workflow is patient walk-ins. When a walk-in patient meets the criteria for one of the CSSPs, a nurse or tech can assess the patient using the appropriate protocol. The patient does not have to be turned away or asked to call the appointment line to schedule an appointment with their primary care manager.
It's important for patients to have walk-in access to the clinical support staff protocols so that they can get rapid treatment for these types of diagnoses without having to involve too many members of the team or have things addressed in an untimely manner.
So if somebody comes in and they happen to fit that criteria, we can get them in that same day as a walk-in.
A lot of times we'll tell them in previous appointments that they can walk in for subsequent visits.
I'll come in for a complaint and then it'll be addressed directly with the tech or the nurse that can follow that protocol and address it the same day.
Whenever a patient does come in, we order the labs, we get them seen. We are able to communicate with lab and the provider on what to do next with the patient. So if a patient does come in here, we're able to see them right away.
But also, if we're using the medical home model by walking in those patients using the technicians from that patient's team. That way they can get to know them, but also if they have any other questions, they can refer them to their provider.
I think it definitely helps the providers to have SSPs because the providers no longer have to see so many patients in a time frame, or they can spend more time with an appointment while we're doing an SSP for something simple, like a walk-in.
The patients like that they're able to walk in for these support staff protocols. They can come in at their leisure during our walk-in hours and get in and get out, as opposed to make an appointment and waiting till the end of the day.
Patients love it because when they do walk in and they're needing to get seen for a shot, an injection, or suture removal or anything, they actually love that they can just walk right up and get seen, get taken care of, and be in and out in a matter of maybe 20, 30 minutes. They love that. It's that instant care that really pulls them into the clinic.
Clinical support staff protocols can be incorporated into the appointment line algorithm as well. If a patient calls requesting an appointment for a visit that meets the criteria for one of the CSSPs, the patient can be booked into a nurse-run clinic. Remember that for this to happen, the appointing clerks need clear protocols for CSSPs and to have been instructed accordingly on how they are managed.
Very important that the appointment clerks know the support staff protocols, so that way when they do get a phone call for a request for an appointment, they can then direct them to the nursing staff.
They're the first point that patients are accessing to try to get care, and so to have them involved in the loop is very important.
We're giving the first impression to our patients, so we always want to have all the information that we can to help them or steer them in the right direction.
When a patient calls in and so they have a concern that falls into one of the protocols that the Air Force rolled out, instead of that patient booking into an acute slot and taking up an acute appointment with a provider, they can be seen by at the lowest level of care. So that leaves those other appointments available for more acute, urgent issues with the providers.
If a patient would call stating that they have a sore throat, we can refer them to our sore throat walk-in clinic. We do ask a few questions to see if they do qualify for the sore throat walk-in clinic.
The appointment clerks, it's important for them to know that we do have the support staff protocols. That way, they don't take up all the acute appointments, for the day. We can take care of the issue without having to book that appointment.
Because if we are completely booked for the day and we don't have access, that is a way to get our patients into the clinic without having a booked appointment with their PCM.
The staff love using the staff support protocols because they're able to be independent and they're able to follow an algorithm and make them feel like they're part of the team and providing care to the patient.
From the time that they call the appointment line or walk up to that front desk, they are being cared for by a cohesive team that understands the needs, understands the complexity of the specific issue, and knows how to triage and better suit that patient, whether it be a walk-in appointment or whether it requires something more.
Hi, how may I help you?
I have an appointment with Dr. Green. Name is Jennifer Ritchie.
May I please see your ID? Can you please confirm your name and date of birth?
My name is Jennifer Elaine Ritchie, date of birth July 2nd, 1990.
Thank you, Lieutenant Ritchie. And it appears you have an appointment for cold symptoms.
Yeah, I think it's a cold. I just have a really sore throat.
All right. Well, I have some paperwork I need you to fill out, please. Go ahead and take a seat and someone will be with you shortly.
Sometimes patients who meet the criteria for one of the clinical support staff protocols end up with a scheduled appointment. Now, this could happen due to a simple oversight by the appointment line or because the real reason for a patient visit isn't readily apparent on the schedule. If the scheduled appointment is due to oversight, the med tech who scrubs the records before daily huddles should identify any patient scheduled for a visit that meets the criteria for a CSSP. The tech should then engage with the patient to determine the appropriateness of conducting a support staff protocol. Sometimes it's impossible to know that a scheduled patient visit meets the criteria for a CSSP. For example, a patient may have scheduled an appointment for a cold, but their primary symptom is a sore throat. It's only when the patient checks in that the med tech will be able to determine that the visit meets the criteria for the sore throat protocol.
Okay, Ms. Ritchie. I'm going to ask you several questions regarding your primary complaint today. How long have you had a sore throat?
It's been about 7 or 8 days now.
Okay, have you had a cough?
No, just a sore throat.
Any fever since your throat started hurting?
Yeah, I think so. I had terrible chills last night, but I didn't take my temperature.
Okay, well today your temperature is 100.8, but the rest of your vital signs are within normal limits. Have you been exposed to anyone with strep throat?
No, I don't think so. Not that I'm aware of.
Okay. Well, I need to look in your mouth. I'm going to use this wooden depressor to hold your tongue down so I can see in your throat. Please say ah.
Ah.
Okay, thank you. Now I need to check your neck for any swollen lymph nodes. Swallow for me. Is it hurting here? Well, your lymph nodes are definitely swollen, and you have what's called tonsillar exudate, which is a coating on your tonsils. I'm going to swab your throat to test for strep, run it over to the lab. Dr. Green should be in shortly after that.
Okay, thank you.
Okay.
Staff should use the support staff protocols for patients with already established appointments if the reason for visit could be addressed already through a support staff protocol, so that you're not wasting an appointment that could be used for a different purpose.
And having those support staff protocols allows our triage staff, allows our nursing staff and technicians along with the appointment line to be able to delineate what would require a walk-in appointment or individuals that would require a more extensive appointment for in-depth evaluation of a specific medical issue.
Everything that came down from AFMH or the SSP is actually a very good algorithm for us. Then it tells us what to do, how to do it, and I think it's really good.
The bottom line is that we took care of their initial need when they called the clinic. We do so much more than just, booking and canceling appointments. And I think the best part is that sometimes when we do get those patients, they're a little bit frustrated maybe with the system or that they're not feeling well, and we can take care of what they need. I feel good about doing that every day.
For the patient's perspective, I think it gives them patient satisfaction going into the clinic knowing that they have an appointment with a nurse or with a specific technician.
All the patients know that they're being treated by a full team. They know that across the board, from the time that they get checked in, from the vital signs to the time that they leave and pick up their medications and are out the door, they know that we work as a cohesive unit to deliver quality health care in the best way we can.
How are you doing today, Lieutenant Ritchie?
I've been better.
I'm sure. Your rapid strep test came back positive, which means you have a bacterial infection and you'll need to be treated with an antibiotic. Our records indicate you don't have any drug allergies. Is that correct?
That's correct.
Good. Well, let me take a look in your throat just to make sure there's nothing else going on. And while I'm here, let me also look at your ears and nose and take a listen to your heart and lungs. Sound good?
Okay.
Okay. Sounds good. You're not having any shortness of breath or difficulty swallowing, are you?
No, not at all.
Okay. Well, I've already ordered a prescription for you. It's penicillin. It should take care of this infection. You'll take 1 tablet by mouth 4 times a day for 10 days. It should be ready for pickup at our pharmacy. Do you have any questions for me?
No, I don't think so.
Okay. Sergeant Sturgis will be back to give you some discharge instructions, and I hope you feel better soon.
Thanks, me too.
All right.
Okay, Lieutenant Ritchie, here's a summary of your visit today. Dr. Green prescribed penicillin for you. You can stop by the pharmacy on your way out to pick it up. Take it 4 times a day for 10 days. Even if you start to feel better on day 4, make sure you take all 10 days worth of your meds. Otherwise, you build a resistance to the antibiotic, okay?
Okay.
Also, I want you to throw away your current toothbrush and get a new one so you don't keep reinfecting yourself. Good hand washing will also prevent you from spreading it to others and also help you from getting other infections. If for some reason your symptoms get worse, like you continue to have a fever of at least 101, or your throat pain doesn't improve within 3 to 5 days, please make sure you call us back so we can reevaluate you. Now, if you have trouble breathing or you're drooling because you can't swallow your saliva, go to the emergency room right away. This is a lot of information to remember, so this is all written on your checkout form for you to reference. Do you have any questions at this time?
No, nothing comes to mind.
Do you need a quarter slip, Lieutenant Ritchie? We want you to wait at least 1 day after starting your antibiotics before going back to work to prevent the spread of infection.
I'm still on leave for the next several days, but thanks for asking.
Great. There's one last thing I wanted to cover. It's your preventive health services. Your medical records indicate you're due for your PAP. Would you like me to schedule that appointment while you're here?
Yeah, that would be great. Is there anything available now?
My technicians are very proud to be able to work independently. They don't need to have anybody's permission for this because we've done the training and our commander fully supports us on this.
As a nurse, it gives us chance to just go ahead and triage the patient without talking to the provider by following the protocol. I love doing SSPs because it allows me to have take ownership in my job.
It's important to incorporate the protocols into the daily workflow so that we establish a good habit or pattern about addressing these types of issues through the support staff protocols on a daily basis.